Occupational and personal health of farmers.
Your health is your biggest resource. You should do everything possible to safeguard it while you're at work. There is evidence, however, that many farmers don't give their health adequate attention.
Personal health. Also, recent studies show that male farmers have a negative health profile, with only 35% getting an annual blood pressure check, 29% taking regular exercise, and 26% practicing sunscreen protection. Male farmers between the ages of 15 and 64 have an annual death rate of 5.491 per thousand. This is over twice the rate for professional workers. Cumulative health problems are leading to farmers prematurely scaling back or getting out of intensive and profitable enterprises, such as dairying and sheep.
There is strong international evidence that healthy farmers have fewer injuries at work. So the message is clear: you should pay attention to your health.
The health profile of the traditional farmer household is very variable. The women, as always, seem to score better and they look after their health better. They live longer, on average 6 years more than their male counterpart, and they seem to utilise the services better and recognise what their own requirements are. The male farmer, on the other hand, tends to avoid attending the doctor, has poorer health outcomes and suffers as a result of that. There are a number of benefits to having proper checkups. I think the fatalistic approach that they have had for many years should be changed. Early detection means that you can actually prevent further disability, and often diseases which people feel have a poor outcome are in fact very treatable.
Respiratory hazards. Farmer's lung. Mouldy forage or grain contains many minute spores from the mould growth. When these spores are inhaled, they attack the lung tissue. The protein in the spores triggers an allergic reaction, and after 6 to 8 hours, symptoms of influenza, fever, headaches, shivering, muscle pains and breathlessness develop. To avoid confusion with influenza, tell your doctor you develop the symptoms after handling feed. The higher the dose of spores, the worse the health effect, and one high dose can lead to sensitization of the lung tissue. Exposure to low levels of spores at a future date will then trigger a reaction. Normally, symptoms clear in 2 to 8 days after a single attack. However, repeated attacks lead to permanent damage to lung tissue, leading to permanent breathlessness. Prevention is by avoiding exposure to spores by keeping buildings well ventilated. For example, never enter a grain store with mouldy feed without ventilating the building thoroughly first. Wear a mask as a backup to good ventilation. Consult your doctor if symptoms persist. Exposure to mould can also lead to occupational asthma. Asbestos. The major health problem with asbestos arises when asbestos fibres become airborne due to release from decaying material like boiler lagging or insulating material. This can lead to a form of lung cancer. If exposed asbestos fibre is suspected, access to the area should be prohibited and a sample taken safely for testing. Action required depends on the identification of the fibre. Asbestos cement does not present a health hazard, but precautions are required if asbestos sheeting is being removed, being cut, or being disposed. Noise.
Noise is dangerous due to exposure to high levels over an extended period, or to intense noise for a short period.
Permanent damage known as noise-induced hearing loss is caused when the nerve hairs in the ear which pick up sound and transmit it to the ear become damaged and die. Words cannot then be understood. If it's necessary to communicate by shouting at a distance of 2 meters, then the noise level is above the legal action level. The best way to solve a noise problem is to identify the source and reduce the level and exposure as much as possible. Ear defenders must be worn if the noise level remains above 85 decibels. These should conform to the standard of EN 352. Zoonotic diseases. This is a term for diseases spread from animals to humans. There are over 20 such diseases in this country, including brucellosis, tuberculosis, tetanus, Weil's disease, leptospirosis, and toxoplasmosis. These can cause serious illness or death, so taking every precaution is required. For instance, farmers get brucellosis in 25% of cases where the herd has a breakdown. With Weil's disease spread by rats, there is a high risk of death if treatment is not given early. Measures include minimizing infection by maintaining healthy stock, vaccination, ensuring personal hygiene, immunization, and use of protective equipment. Booklets and web sources of information are available, so get informed. Environmental factors. As farmers work out of doors, sometimes in wet or cold conditions, wearing suitable protective wear adds to comfort and health. When working in warm, humid environments, such as in piggeries, creating an environment that gives thermal comfort is the best approach. The relative humidity should be in the 30 to 70% range. There should be air movement without drafts, and the temperature should be in the 17 to 23 degrees Celsius range. Your health is your wealth. This is particularly the case for farmers. Give your health the attention it deserves.